Hello, Dr. Boylan here with a COVID Smorgasbord video here at Noretta Family Medicine today. So I'm going to talk about 5 topics. The first one is about Merck's new COVID pill, which I'm sure you've heard about. The next one I'm going to talk about is antibody treatments. I'm going to talk about long COVID. I'm going to talk about flu shots and COVID vaccines being given together, and then finally about in-home COVID testing. So you've probably heard about Merck's new COVID fighting pill, and the most important thing that I'd like to say is that it is not a substitute for vaccination. You can think about it as probably being similar, and I say probably because it's going through the emergency use authorization process. So the FDA has to look at their data and make recommendations for how this pill can be approved to be used and all of those things. But it probably will be similar to how Tamiflu functions with the flu when you get sick with the flu. So there's still the flu vaccine. The flu vaccine still recommended, just like the COVID vaccine. We want to try and prevent you from getting sick. But if you do get sick with mild to moderate symptoms, then this COVID pill may be available to you, which will be great because we don't have any oral COVID treatments right now. So stay tuned. That's all I know to say right now about this pill, but please still get vaccinated. That is still the number one take-home message about this pill, is that it is not a vaccine. All right, the second thing is just a reminder that there are antibody treatments out there. So this is the currently available COVID treatment, and it is given through an IV for patients that are at high risk of developing more severe symptoms from COVID once they test positive. So, people that are at risk of being hospitalized or having more severe symptoms from COVID. So if you test positive and you're not sure if you're in that category, just pick up the phone and call. I'd be happy to talk to you about that and see if you qualify for this medicine. I can order it for you, and it is being given at local hospitals. So not actually in the hospital, at an infusion center, which is outside of the hospital. All right, the next thing is that just today I had a patient ask me about long COVID because they said they didn't know very much about it. This phenomenon is a little bit I'll say unique to COVID, in that 4 weeks after you have COVID, some patients have developed long haul COVID symptoms. So they've continued to have COVID symptoms despite not being infectious with COVID anymore. This is a relatively unique thing. I guess it has happened with other infections, but just very unique. And it's also interesting that so many organ systems can be involved. So here's a list of possible long haul COVID symptoms. Shortness of breath, tiredness, tiredness after exerting yourself, brain fog, cough, chest pain, headaches, abdominal pain, muscle aches, joint pains, lightheadedness, insomnia, which is one that I hear about a lot, a rash, mood changes, among other. Loss of taste and smell for a prolonged period of time. So these are symptoms that, I don't know that we are able to predict who's going to develop long COVID symptoms, but this is yet another reason to get vaccinated, because we know that people that do get vaccinated have a lower risk of developing long COVID symptoms. We're learning more about this, so I can't really tell you again very much more about this phenomenon, but just that if you do get vaccinated, you have a lower risk of developing these symptoms. These symptoms develop even in patients that have not been hospitalized for COVID. So again, just something to think about when you're thinking about, well, do I get vaccinated or do I take my chances at getting COVID? So you can develop these long COVID symptoms even if you are not hospitalized. Okay. All right, the next thing is about flu and COVID vaccines. You can get them together. This is perfectly acceptable, perfectly reasonable. And so especially if you're getting a COVID booster, it might be a good idea to get a COVID booster and a flu shot together at the same time. There's no problem with doing that. In fact, most vaccines can be given together. And as I may have mentioned, Noretta is going to have all adult immunizations, or most adult immunizations. So just contact me if you are interested in this. We will not have the COVID vaccine here, though. That's the one catch. It's just too complicated of a process right now for this small office. Finally, just a reminder that there are at-home COVID tests available. I believe that Amazon and Walmart have the more affordable ones. I think there are 2 in a box for $14. Those have sold out very quickly. There are apparently more on the way, but just a reminder that if you have symptoms and don't want to leave your house, you can get one of these tests to do at home, and your results come back in about 10 minutes. Just a reminder, though, about these rapid tests and rapid tests in general. They are much more accurate if you take them when you have symptoms. So they're not good tests to take to say, okay, well, I feel perfectly fine, but let me just take a COVID test to see if, I have COVID so I can be around people tomorrow. So that is, it's not the greatest test for that purpose, but if you are having symptoms, they are very accurate. So just a reminder about that. All right, that's about it. Take care. Bye-bye.